Good morning. My name is Steve Hernandez, and I'm the Executive Director of the Legislature's Nonpartisan Commission on Women, Children, Seniors, Equity, and Opportunity. Today's date is Wednesday, September 29th at 10 a.m., and we are today organizing our inaugural meeting of the Gun Violence Intervention and Prevention Advisory Committee created by statute in the state of Connecticut. I will not belabor my introduction on the charge of this group. I know that we have a chair that has been appointed who our administrator, Pina Violano, administrator for this task, will be introducing. But I just wanted to welcome you and thank each and every one of you for the work that you are about to embark on. This is work that you have been steadfastly working to further in the state of Connecticut for many, many years. And the last several months and years have really taught us that there's a lot of work left to be done. The purpose today is to really bring all of your efforts together in as coordinated a way as possible so that we can really start to see a change and a turn in the curve of gun violence in the state of Connecticut, and not only the costs that it is levying on the state, but more especially the costs that it is levying on families and communities in the state. So without much further, I'd like to introduce Pina Violano, who will be our administrator for this work moving forward. I will be present in many of these conversations, if not all, but Pina will be administering this work for us. Dr. Violano was the inaugural and now retired manager for injury and violence prevention for Yale New Haven's Hospital's Level 1 Trauma Center. She was also the founder and director of Injury Free Coalition for Kids of New Haven. She has long-standing leadership and expertise in reducing the impact of preventable injuries and death through community outreach, community engagement, and violence prevention efforts locally, regionally, and nationally. Her efforts have centered on the reduction of gun violence through gun buyback programs, safe storage of guns, educating gun shop owners on risk factors for suicide and the mentally unstable. She has collaborated with numerous police departments and hospitals and street-based outreach worker programs to reduce gun violence, specifically among young and ex-offenders through education, advocacy, and mentoring interventions, especially within the city of New Haven and Hamden. This work has culminated in the creation of Yale New Haven Hospital's first hospital-based violence intervention program. She currently is the CEO of Healthcare Consultants and a professor at Quinnipiac University School of Nursing. She's also the co-founder of Swords to Plowshares Northeast, a program that is passionately about gun safety and the value of gun buybacks to remove unwanted guns from homes and neighborhoods and transforming the destroyed guns into gardening tools and jewelry. Her commitment to this work is clear and evidenced by her trajectory, her professional and personal trajectory. Pina, I'd love to welcome you and hand the baton over to you as our administrator. As a point of personal privilege, I want to welcome our dear Senator Marilyn Moore, who has joined us. I can see you there, Senator Moore, welcome. And of course, our wonderful chair, Andrew Woods, who will be introduced by Pina. Pina, thank you so much, and please take it away.
And thank you, Stephen. Appreciate your kind words. Welcome, everyone. It's a privilege to serve as the administrator and fellow for this great committee. And I welcome each and every one of you and look forward to bringing forth excellent recommendations and moving the whole issue of gun violence forward. With this, I'd like to introduce Senator Marilyn Moore, who is one of our biggest champions. She was elected in 2014 to serve the 22nd Senatorial District communities of Trumbull, sections of Bridgeport and Monroe. As a lifelong Bridgeport resident and community activist, Senator Moore has been a force in advocating for health equity, living wage, and legislation that supports and protects Connecticut communities. In 2002, Senator Moore founded the Witness Project of Connecticut, which serves to address and reduce the incidence and death rates of breast cancer among low-income and African American. With the assistance of dedicated staff and board members, over 1,500 women were reached annually in the battle against breast cancer, for which she received the Planned Parenthood of Southern New England's First Voice in Vision Award for her leadership in advocating for health equity, advancing reproductive freedom for Connecticut women and family, She's most proud of this award because it's where she began her work more than 20 years ago, addressing health equity for women. She's nationally known for her advocacy on behalf of breast cancer and is an active participant in the war against hunger, social justice, and racial inequity. To further improve health outcomes, she has become an advocate to combat chronic diseases through nutrition and implemented body and soul in several Bridgeport churches. Senator Moore stays connected to information and advocacy groups by actively participating in projects whose mission address food access and is a member of the network support team for the Connecticut Food Systems Alliance and is Connecticut's ambassador on food solutions in New England Coalition, who seeks to build regional solutions to food sustainability within the New England states. Locally, Senator Moore organized coalitions in Bridgeport to address food equity, and as a result, the city of Bridgeport formed a food policy council. She is also a state director for Women Legislators Lobby that equips women state legislators to maximize their success in their states. Senator Moore has been involved in local politics, and she worked on the campaign for Tisdale for mayor and has coordinated several successful campaigns. In 2013, Senator Moore challenged a 6-year incumbent for a state Senate seat and was successful in her bid to represent Trumbull, Bridgeport, and Monroe. She's currently the chair of Human Services, General Bonding, and vice chair of Finance, Revenue, and Bonding, and is a member of Children's Executive and Legislative Nominations, Legislative Management, and Public Health Committees. Her commitment to her constituents are to address health equity, living wage, and promote legislation that supports safe communities and protects the rights of all. She has received numerous awards and accolades, including African American Affairs Commission Women of the Year, NAACP Community Service Award, Negro Business and Professional Woman of the Year Award, Sojourner Truth Award, Cape Verdean Women's Association Community Service Award, New Hope Missionary Baptist Church Mother of the Year Award, American Cancer Lifesaver Education Award, and was selected to be the Juneteenth Parade Marshal. I know that this issue of gun violence intervention and prevention is something that Senator Moore is very passionate about. Please join me in giving Senator Moore a very warm welcome. Is Senator Moore there? Yeah. Can you unmute? Yeah.
Good morning.
Good morning.
I said we really have to cut back on that bio. But thank you.
It's impressive, and thank you.
For me, sometimes it's good for me to hear where I've been and where I am, because it's such a journey. But at the end of the day, what I care about is people. So good morning. This is a historic day. I want to welcome all of you to being appointed to the Gun Violence Intervention and Prevention Advisory inaugural meeting. And Pina, you are just a blessing. And I thank God for sending you our way. Nationally, we've witnessed an increase in the gun violence among our youth, and you've all been engaged in various methods on how to address, how to prevent it. And many days you intervene when you don't even expect to. I appreciate your commitment to our youth and our families. I want you to know how I became involved in this. There were several shootings in Bridgeport where I live. And there was an opportunity to work with RIASAP and Mark McDonald in Bridgeport. And I was able to secure $500,000 over 2 years to create a gun violence task force in Bridgeport. Many of you across the state were already doing this work. And many of you I did not know prior to getting this funding to do something in Bridgeport. I wanted to bring the service providers who are doing the work and who are engaged every single day together and say, what do we need to do? I had been listening to people off and on talk about we should do this and we should do that. That committee created a report at the end of 2 years, and their final report validated what most of you already knew, what they already knew, that we needed a single place to coordinate funding and services. All the groups in Hartford and New Haven who were addressing youth and gun violence agree. But there was consensus among all the advocates from across the states that we needed a commission. And I heard you. when I say I heard you, I heard you. I know that people had been working on a commission long before I stepped into this, but sometimes you have to speak to the right people. Certain ears need to hear what needs to be done. And there are opportunities that we need to take advantage of when we hear something. At the time when I learned more about having a commission, we were working on a budget, and we were working on Senate Bill 1. And I want to thank Senator Looney, Martin Looney, and Senator Mary Abrams, Chair of Public Health, for embracing the concept, who assisted me along the way, because I tell you, I did not know what to do, how to do it, but I knew I could get it done. And I knew God would send me the people I needed along the way. And Mary Abrams, Senator Abrams, was the person who really said to me, Marilyn, if you want to put it in Senate Bill 1, let me work with you to get it done. In Senate Bill 1, we put legislation that's very clear about the roles and responsibilities of this committee, this advisory group. You have been selected because you are the ones who know about what's happening on the ground. You are the ones in the community dealing with it every single day. There's no better way to address this crisis of gun violence among our youth than putting it in the hands of those who do the work. It's time for us to bring the people into the equation and get their voice to the table. And that is you. And that is why you are here. Each one of you have been selected for your expertise, for your commitment, and for your knowledge, and for the work that you're doing in the community. Your chairperson is Andrew Woods, and he was appointed by Senator Looney on my recommendation. Andrew has worked in government, nonprofit, and is experienced in leading work groups on gun and youth violence. I look forward to a robust conversation, a collection of ideas and thoughts that will result in a strong, well-prepared recommendation to the legislation in December. The work that you do now will help us put together the Commission on Gun Violence Prevention and Intervention that will come to the General Assembly when we meet in February. But prior to that, we'll come to the Public Health Committee and Human Services for review. You have a charge. I trust you all. I will try to make as many as I can in the way of meetings. For the meetings I don't, I will review them on CTN to hear what was said. And I hope that you all know that we can get this done. And collectively working together, this can happen. We could have a commission in 2022. I want to thank Steve Hernandez for agreeing to take this on and as a charge, and that we have a place to bring everybody together. So thank you. And I look forward to hearing from all of you all. Have a great day. Thank you, Pina.
Thank you, Senator. We appreciate you being here with us today. Next, I'd like to, at this time, would like to introduce the chair of this committee. Andrew Woods is the Executive Director of Hartford Communities That Care. He's also the Director of Connecticut Hospital Violence Intervention Program Collaborative. He founded the Hartford Communities That Care in 1998, and he established the Hartford Care Response Team in 2004. He's one of 40 plus national recognized hospital-linked violence intervention programs in partnership with Trinity St. Francis Hospital and Medical Center in Hartford, Connecticut. In 2019, the HCRT became the first HVIP in Connecticut to secure Victims of Crime Act or VOCA funds. In recent years, the HCRT established a clinical group practice to meet mentally health trauma needs of gunshot victims and their families, and partnered with a physicians and a skilled nursing agency that provides in-home wound care for shooting victims released from the hospital, while coordinating their care with behavioral health outpatient primary care physicians. Between 2013 and 2015, Governor Daniel Malloy appointed Mr. Woods to serve on 3 commissions in the aftermath of Sandy Hook school shootings in Newtown. One related to victims' rights, another related to the enforcement of victims' rights, and the third focused on youth urban violence. In 2016, Andrew was selected to serve on Connecticut Department of Mental Health and Addiction Services Policy Academy, a system transformation effort charged with evaluating and further developing the state's array of crisis prevention, intervention, and postvention services. In 2020, Mr. Woods co-founded the Connecticut Hospital Violence Intervention Program, collaborative consisting of membership from Connecticut Children's Medical Center, Hartford Healthcare, Yale New Haven Hospital, Trinity St. Francis Hospital, and the Connecticut Hospital Association, the HAVI, or Health Alliance for Violence Intervention, and several policy community foundations and advocacy groups. Mr. Woods is also chair of UConn Boys and Men's of Color Multi-Sector Alliance for Health Equity, a training faculty for the Health Alliance for Violence Intervention, and serves on various civic boards. Please give a warm welcome from my esteemed colleague and chair of this committee, Mr. Andrew Woods.
All right, Pina, thank you very much and welcome everyone. And I'm glad to be here today. It's really a privilege just to see everybody on the screen here, that folks that have been committed to this work, every single one of you that I know personally, and your commitment to doing the work that we have been charged to do. Special thanks to both Stephen, Pina, and TJ with the Commission on Women, Children, Seniors, Equity, and Opportunity. I'm glad to see that you guys are going to be providing the staff support and guidance for the committee here. And I'm looking forward to the outcome of our final report when we get to that stage. But before we go further with the agenda and other items on the agenda, I want to give folks on the other members here a chance to, one, share their name of your organization, the details about your organization and the work that you do. And so how do you want to do the roll call on that?
I was going to say, Andrew, how about if we do roll call first and then you can take it from there?
Sure, that's
okay?
fine. Absolutely. Yep.
So here representing the Connecticut Hospital Association is Carl Schitzel. Here representing Compass Youth Collaborative is Jacqueline Santiago. Here representing Connecticut Violence Intervention Program is Leonard Jihad. Regional Youth Adult Social Action Partnership, or RACEAP, here is Ebony Epps. Hartford Communities That Care, Andrew here, and also our chair. Connecticut Against Gun Violence, Jeremy Stein. Project Longevity, Glendra Lewis. St. Francis Hospital and Medical Center, David Shapiro, or Dr. Shapiro. Yale New Haven Hospital and Dr. James Doddington. Hartford Hospital, Dr. James Jandro. You Are Not Alone, Dawn Spearman. Mothers United Against Violence, Deborah Davis. And the Javi, Kyle Fisher.
Okay, so why don't we, thank you, Pina. So why don't we go in that order? And we'll start with Kyle Schitzel. Again, name of organization and details about your organization. We can start there. Carl.
Thank you, Mr. Chairman, and it's a privilege and a pleasure to be continuing this work. I was delighted to be appointed by Speaker Matthew Ritter, representing the Connecticut Hospital Association, which is the trade association for all hospitals in Connecticut, general, acute care, psychiatric, children's, and rehabilitation. We've been proud to work on this issue for several years, well acquainted with many of you, looking forward to meeting new members as well. One of the reasons I think CHA is part of this group is happy to promote the existing work being done by the other hospitals here, but also spread the word about what can be done in other communities around the state to truly achieve an aligned statewide approach to this work. Thank you, Andrew.
Thank you, Carl. Next will be followed by Jackie.
Hello, everyone. Congratulations, Andrew, on the chair position, and it's an honor to be here today. My name is Jackie Santiago, and I am the CEO at Compass Youth Collaborative, and we connect with Hartford's highest risk youth wherever they are. We're engaging them in relationships to make sure that we can provide supports and opportunities to help them become ready, willing, and able to succeed in education, employment, and life. And essentially, we are hiring people that have the same lived experience as youth. Some of them are formerly incarcerated, but they are truly the messengers that the youth believe in. And so we are out in the communities, canvassing the community, making sure that we are ambassadors of peace, but also intervening in any incidents of violence. And we are also responding with HCTC when there is an incident with the youth in our target population of 16 to 20 years old. And we are following up to ensure that there is no retaliation, as well as making sure that we enroll them in our program so they can get case management, mental health supports, reconnected back to school, and or employment. We are essentially a critical partner to many in the city of Hartford, but in particular, we do partner with Hartford Police, and we do partner with Hartford Public Schools.
Thank you very much, Jackie.
Thank you.
Okay, Leonard.
Hey, great morning, team, and congratulations to everyone, Pina, and also Andrew on your appointments. And I'll just ditto everything that Jackie just said. And but we're in the greater New Haven community. And my official capacity is Executive Director of Connecticut Violence Intervention Program. We work with youth aged 13 to 24 engaged in risky activity in the community. So more so being a shooter, being a victim of violence or group or gang activity. And we also, respond to the hospital. I supervise a group of credible messengers or violence prevention professionals in the greater New Haven community, including the town of Hamden. Thank you.
Thank you very much, Leonard. Ebony.
Good morning, everybody. Congratulations. And it's an honor to be here with people doing such great work and similar work. It's nice to connect. My name is Ebony Epps. I'm the program director of Street Safe Bridgeport. RiotSAP is our parent company. We work with males ages 14 to 24. We mentor them 24/7, go into the communities, into the schools, into courts. And I have a team of 7 credible messengers who help support the youth. We also have MOUs with Bridgeport Hospital and Hartford Healthcare, formerly St. Vincent's Hospital. And we're called to help with de-escalation and to help try to curb retaliation if someone's shot, murdered, or stabbed, or any act of violence. It's great to be here. Thanks for having me.
Thank you very much, Ebony. And we'll go to Jeremy.
Good morning, everyone. I'm Jeremy Stein, the Executive Director of Connecticut Against Gun Violence. Andrew, congratulations. Pina, congratulations. I want to thank the House Majority Leader, Jason Rojas, for appointing us to this position. Our Connecticut Against Gun Violence was founded in 1993 in Bridgeport because of a drive-by shooting that took the life of a child. And as a result, 2 women got together and they decided they wanted to put an end to gun violence. Started with 2 people in a kitchen. Now we're over 100,000 strong. For the last almost 30 years, the way that we've been reducing gun violence in Connecticut is by legislative advocacy, by helping to draft, lobby, and create strong gun laws in the state of Connecticut. We've been a national model around the country, and some of the common sense solutions that we have helped to draft have been utilized in other states. But we also know that some of the solutions to gun violence may not always be just a gun law. Some of those legislative solutions are in the creation of things like this council, which we are a big part of, to help create, along with just about everybody on this call. So we are really proud to be here. We're honored to be here. The idea behind this was to make sure that the state of Connecticut was supporting common sense solutions to gun violence, supporting the organizations that are doing the work, the boots on the ground organizations, and to make sure that the communities that were being served and those organizations that were doing the work were central to helping create those solutions. So we are here to help in any way that we can, and we're grateful to be here. So thank you, Andrew.
Yeah, thank you, Jeremy. Okay, Glendra.
Good morning, everyone. It's great to see you and great to be here and participate in this worthwhile work. My name is Glendra Lewis. I am the project manager for Project Longevity, the Hartford location. And our client base are 18 to 24-year-olds. We utilize the Group Violence Intervention Strategy, or GVI, which is an unprecedented strategy that partners with law enforcement, community partners, social services partners to provide services to those who are either driving the violence, at risk of being victims of the violence, or influencing the violence in our communities. This is not purely a law enforcement approach. It draws equally on the moral voices of our other partners in order to prevent, intervene on violence in our community. It was developed by David Kennedy of National Network, and it has a long-standing history throughout the country, including Detroit, Chicago, LA, and Oakland. I am pleased to be here and participate with you and learn from you all. Thank you, Andrew.
Thank you, Glendra. David. I can come back to David. James.
Thank you, Mr. Chair. Huge congratulations, Pina and Andrew. It's wonderful to be here. My name is Dr. Jim Doddington. I'm the medical director for the Center for Injury and Violence Prevention at Yale New Haven Health. I'm extraordinarily excited to be here representing both Yale New Haven Health, and great thanks to Representative Candelora, who appointed us to this committee. I am a part of the growing HVIP collaborative here in the state of Connecticut. I work closely with many of the representatives on this call. We operate a hospital-based violence intervention program here at Yale New Haven in close collaboration with Leonard Jihad and CTVIP. We've been lucky enough to have the partnership of groups and other members on this call as we continue to expand our work. And we are also part of the Health Alliance for Violence Intervention, which we have representation from Kyle Fisher. So excited to be here and looking forward to this great work.
Thank you, James. Okay, we got David. Got another James. Nope, Charles.
Yeah, good morning.
Yeah.
Dr. Charles Jandra, representing Hartford Hospital and Hartford Healthcare. I really appreciate being part of the group. Look forward to a great conversation, and a lot of the faces on the call today are new to me, so look forward to working together. I feel my exposure to gun violence is probably a few fold, and that's working as an attending physician in the emergency department at Hartford Hospital, and also as the EMS medical director for our health system, Hartford Healthcare, and being very closely involved with the EMS, police, and fire agencies in Hartford as their medical direction. So really thankful to be part of the conversation, as I know, watching the news daily, my heart sinks for what's going on. So looking to be part of the change. So thanks for having me.
Hey, thank you, Charles, and welcome. Deborah.
Good morning, and thank you, Andrew. Congratulations to you and Pina and all of the staff that's working and the administrators that are working with this unbelievable and well-timed committee. This is just what the state of Connecticut absolutely needed. And absolutely honored to be here as well. And because I'm with the Mothers United Against Violence, an organization that's been around since 2002. Our primary goal has been to embrace and serve the underserved community as it relates to mothers and families. And because we found that there was not enough resources and outlets for some of our moms and families to connect to, we obviously decided that this was a great need. And so with that work comes with embracing the family before and after the violence. We provide the support both on the home care side and also making the absolute connections to resources in terms of mental health and any other resources that those families may need. So in serving directly for those families, we help to promote stabilization. And so our key now is to make certain that our families can continue to work within their community and find the resources that they need for sustainability. But on the intervention, prevention side, on the violence, the gun violence, which we all know that is #1 across the country, we have been involved in that area since the 2002 timeframe. And so with that, our primary goal is to provide that direct support. We've worked, obviously, we're a partner in the hospital prevention program, along with Andrew. We're also part of the Community Safety Coalition, where we reach out on an organizational an effort to help to promote and bring the connectivity across the community. That is everyone working together. And so we're excited about this, and we're ready and continue to be ready to get the work done. Thank you.
All right, thank you, Deborah. At this time, we'll go with Kyle.
Hi, everyone. It is a pleasure to be here, and I feel privileged. Thank you and congrats to Andrew and Pina. I'm Kyle Fisher. I'm the Policy Director at the Health Alliance for Violence Intervention, or the HAVI. We are the national organization that represents hospital-based violence intervention programs. We have about 43 member programs across the country, as well as about that same number of new and emerging programs. Most of our work goes into building, supporting, and expanding programs through training and technical assistance for programs that are getting started off the ground. We do peer learning for programs that exist and are doing efforts to improve and expand. And we also do a lot of policy work as well. So thank you so much for inviting us here today. And it's great to get to know you all. Thank you.
Okay, thank you, Kyle. I understand that David may not be on the line at this time, but we'll be catching up with him soon. So before I pass it back to Pina, just want to make sure that folks also know that CTN, if it hasn't been mentioned, that this is CTN is in the room and it's being broadcast live. And so we want to thank CTN as well for covering this, and we'll be covering each of our planned meetings. So Pina, I want to pass it back to you.
Great, thank you, Andrew. And again, welcome everyone. What I'd like to do at this time here is go over what the advisory committee's statutory obligation is. Each one of you should have received a 2-pager there that we've kind of condensed down the statute itself and be very specific to Section 9, which is what we're going to be responsible for here. And what it states is that we are to establish a committee to advise the Public Health and Human Services Committees on establishing a commission on gun violence intervention and prevention, to coordinate the funding and implementation of programs and strategies to reduce gun violence. The Act establishes a gun violence intervention and prevention advisory committee. The committee's purpose is to advise the Public Health and Health Services Committees on establishing a commission on gun violence intervention and prevention to coordinate the funding and implementation of evidence-based, community-centered programs and strategies to reduce street-level gun violence in the state. As was mentioned earlier, the Commission on Women's, Children's, Seniors, Equity, and Opportunity from the Connecticut General Assembly is staff is responsible for the administrative piece of this committee. The committee charges, the Act requires that the committee, basically there are 5 charges, and I'm just going to state them, and Andrew will go into these in depth after I'm done here. But 1 will be to consult with community outreach organizations, victim services providers, community violence and gun violence victims and researchers, and public safety and law enforcement representative on strategies to reduce these types of violence. Our charge number 2 is identify effective evidence-based community violence and gun violence reduction strategies. Strategy 3 is identify strategies to align state agency resources to reduce this violence. 4 is identify state federal and private funding opportunities for community violence and gun violence reduction initiatives. And 5, develop a public health and community engagement strategy for the Commission on Gun Violence Intervention and Prevention. The act also requires that this committee report on its findings and recommendation to the Public Health and Human Services Committees by January 1, 2022. The committee terminates when it submits the report on or on January 1, 2022, whichever is later. And I'm going to turn it back over to Andrew here, who's going to take us through in depth of what our charge is.
Okay, thank you, Pina. Okay, I'm going to go through each of the mandates with some detail. Then after that, we're going to open it up for some of your thoughts, as well as any additional ideas that you might have in terms of addressing some of our priority mandates. And so with section number 1, mandate number 1, principally here, what we want to do is to request that committee members, each of you, submit names of individuals and organizations we need to have that might want to testify before this particular committee, as well as folks that may want to recommend strategies that we need to be considering that can be included in our plan back to the state. And so with this piece here, we clearly, I know that some of you, I've heard folks have reached out to you and they want to provide input, they want to provide feedback, they want to be able to make sure that their voices are heard during this process. By all means, please get those names, get any information that they would like to communicate to us, and get that over to principally Pina as the administrator. And then ultimately, we'll be looking at all of that and figuring out a way, a strategy that's fair to all individuals that want to submit information, to include that even for opportunities for testimonies, but certainly anyone that you're encountering, we will love to make sure that they have something in writing that can come to us. That way it can be part of the official record. And then in addition to that, with mandate number 1, our next upcoming meeting, we will actually focus on and even seek to invite as many of those individuals as possible, as well as to review some of the testimony or some of the strategies that folks have submitted to this commission. Mandate number 2, similar to that, is again, submit names as well as strategies and publications related to this section, but also more specifically announce to folks that we are interested in research-based strategies as well as evidence-based programs and publications to see what information is out there that we can include in our assessment. Also identify effective grassroots efforts. And I want to put a little emphasis on grassroots efforts. Clearly, it's always about the best practices, is always about promising approaches. In fact, grassroots efforts are in many respects promising approaches. And we want to make sure that folks that are out there doing work that doesn't necessarily meet the level of a research-based program, that also gets attention to this particular committee. That way, that folks that are out there in our communities that are doing great work, we want to know about it. We want to see what we can do to incorporate that into the plan, and then hopefully, ultimately, support some of that work as well. Mandate number 3, identify strategies to align with resources of the state agencies. Now here we want to invite state, national, federal agencies who we would want to present at our meetings. So give an example, there's VOCA, Victims of Violent Crime, the judicial branch, CSSD, and other folks that do the work by administering VOCA. We got folks over at OPM, we got folks over at DEMIS, we got folks at DPH, and a variety of other different agencies that may want to, and we believe should be, testifying or presenting the kind of strategies and programs and services that they not only fund, but also some of the work that they're doing out there that they would like to see enhanced. But also to hear from them ways by which they believe they can begin to coordinate those resources and get recommendations from them on how they believe they can coordinate those resources. We may have some of those ideas ourselves, but certainly to be able to hear from the state agency leads on how they themselves would look at pivoting their resources towards this work, and again, aligning them and coordinating those services or dissemination of resources to support the work that we're looking to address. Number 4, taking a look at funding from both the state, federal, even private and corporate funding sources. What funding might be coming down the pike, both federally and statewide in 2022? What funding is currently in place that may not be expended to deal with some of the issues that we're charged with dealing with? We also should identify disparities in funding as it relates to community violence programs and law enforcement programs. So let's keep that in mind as well. We certainly want to know exactly what's out there and what may be potentially coming. And then finally, for the section number 5, which is to basically develop a public health and community engagement strategy for the commission. We need to involve DPH, not just at this phase, but also in previous phases, community health providers, to help us begin to start looking at ways by which we can develop a public health and community engagement strategy to start elevating the work that we're charged to do here on this advisory committee, as well as what we will be recommending clearly to the legislature. So I'll stop there for right now, and I'd like to open up the floor to basically hear from each of you, or as many of you, as to any thoughts that you might have had prior to coming to today's meeting, and especially in relationship to some of these mandates. And by the way, with the mandates, as you noticed on your agenda, we have at least 1, 2, 3, 4, 5 meetings that are currently in place, today being one of them. But each of those meetings, we want to devote time towards one mandate per meeting. But that would mean that we may also need to include additional meetings, because I believe we got started a little bit late, and this time is going to crunch in on us real fast. And so I want you just to be mindful that we may be calling on each of you, or as many of you as possible, to be able to spend a little bit more time helping with this process, if that makes sense.
Absolutely.
Yeah.
Andrew, and I'd like to just note that Dr. Shapiro joined us, and if he would take a minute to tell us a little bit about himself and
Absolutely.
represent.
Absolutely.
Thank you.
All right. Dr. Shapiro?
Good morning, all. Thank you for having me and allowing me to be part of this committee. Pina, good to see you.
You too.
Good to see you. The rest of you that I don't know, I've a pleasure meeting you. I look forward to meeting you in person. I'm a general trauma and critical care surgeon at St. Francis. I've been in the business here at St. Francis for the last 14 years and come from the Hartford area for my training. I know Dr. Donington as well. Nice to see you. If I can be helpful on any of you in the hospital side of things, I'm glad to do it. We've been involved in a variety of efforts to help current unrelated injuries in Connecticut. They all contribute to the downfall of communities, and certain communities get hit harder than others, as many of you are here. If I can be helpful in that, please let me know. If I need to be educated on other things, please do not be hesitant or shy about educating me. I don't have the experience of being in certain communities, whether it's a person of color or a person in a different environment. I want to have that experience as much as I can. So please let me know what I can do and how I can help. I'm glad to be here, and again, thank you, Mr. Chairman. Back to you.
Okay. Thank you. Thank you. Thank you very much, Dr. Shapiro. Okay. Why don't we go ahead and open up the floor? We can actually use, if folks can raise their hand in the on your screen. I'd like to be able to call on each of you so that we can begin to hear some of your thoughts and feedback on this process, and again, anything that you feel might be helpful. Who do we have? Any hands raised? Okay, Deborah. I see Deborah's hand. Deborah, please, there you go.
Okay, thank you. Thank you, Andrew. I just wanted to find out if there was a specific time for the testimonies. Do you have a time frame scheduled for that for some of us that are boots on the ground, and for some of those testimonies?
Yes, certainly. Come the next meeting, we clearly, if folks can get us as much information and those names as quick as possible, we would like to devote at least the first hour of the meeting, next meeting, to actually hear from folks during that time. And then we can use the other half of the hour, the other half of the program, to discuss and continue to deliberate part of our charge. So the sooner we get names and information, that will be helpful. But also bear in mind that those that will be testifying, we would want them to follow pretty much the similar rule that's being implemented at the state capitol when folks are testifying before the legislature, which is up to 3 minutes of testimony. That way we can squeeze in as many people as possible. So certainly those that you recommend, if you can work with them, prepare them, and let them know that that's what the limitations will be on the testimony. And again, anything in writing would also be helpful that can expand on what they shared with the committee. Is that helpful, Deborah?
Okay, oh, that's very helpful. Thank you. Thank you.
Okay, thank you. I believe Glendra.
Yes, Andrew, I was just thinking, since we have a short amount of time in which to get a lot of work done, do you know if that we will be breaking down to like a subcommittees of any type or anything like that to try to expedite the process?
You know, that's a very good question. And I think that's something that we do and we will need to consider, because there's going to be a lot of information coming our way. And I anticipate that it would require that additional support for folks that may want to look at different, say, content areas or subject areas, subject related areas around this work. So I'd like to hear from other folks along those lines as well, because, you know, we don't want to start a subcommittee of this or an ad hoc, if you will, and then there was only a person or one individual on that particular committee. Now, if it's so let's at least hear from other folks on that, and let's definitely consider that.
And Andrew, I just want to make one point here. Those of you that are here representing community-based organizations, you will be that representative and the voice for your own organization. So just want to make sure that we're aware of that for you. Okay.
Okay, Kyle.
Thank you, Andrew. On the subcommittee question, just to comment on that, I think that certainly makes sense, and perhaps we could convene them after we get a little bit more information. We know which ones we might need. The question that I had was, it seems as though a lot of the charge for the first couple of meetings is gathering a lot of information and compiling it and processing it. So I'm curious if we've thought about, a system that we could do that without duplicating each other's work, whether or not it's, a shared document through Google Docs or something else, so that, I would imagine a lot of us are thinking of probably the same names. So I just want to make sure we're not duplicating each other's work and making sure everything gets covered.
Yeah, and I can take that, Kyle, from you there. We will be setting up a shared document for all of us, and if everybody can pop it in there, and then I'll try to do some type of organization with it. So absolutely, I apologize for not mentioning that earlier. So great idea.
Thank you.
Okay, any other hands, any other thoughts?
And I think just one other thing to add to that, if you're at an organization that does not allow Google Docs, please let us know in a different email to send you an invite for that, so that you can access information.
Okay. So it appears that everything is at least clear for now with folks in terms of what we need to be doing between now and the next meeting. And that is, again, sure you have colleagues that would be interested in submitting testimony as well as reports and some of the work that's being done across the state. And so certainly I would say let's just get to it, and then we'll start sorting through it behind the scenes and seeing what we can do to get as many voices heard and as much information to contemplate during our deliberations. So
yeah, and we'll be compiling some parts of the report that we can do now. And one of the things I'll do is send around the attendance list here. So if you can please take a look at it. If I have your correct spelling of your name, how you'd like it in the report, and just get that back to us as soon as possible as well. Okay.
Glenda, I see your hands back up again.
Yes, I'm sorry. I have another question. I was just thinking about when we're looking at best practices, I hear that you're talking about what we're doing across the state, but are we considering what's being done at a national level when we're looking at best practices?
Oh, by all means, absolutely, absolutely. What's being done in other parts of the country are just as relevant or could be irrelevant here in the state of Connecticut and be adopted to some of our communities. Thank you for raising that.
Yeah, and if you could provide us a contact person name and as well when you're submitting stuff outside of Connecticut and in Connecticut for us would be very helpful.
Okay, well, folks, it looks like we may have, oh, Jeremy.
Sorry, I didn't mean to be the spoiler. One of the things that I had a question about was, as you know, whether or not this is going to remain virtual, or if the Capitol opens up, whether it's going to be in person. And one of the suggestions I have is just directly to what Glendra was saying is, I think there's some great advantages to virtual meetings. It's much easier for us to communicate, but also if we are looking to communicate with those partners who are doing the same type of thing in places like New York, New Jersey, California, seems to make a lot of sense that we can bring them onto the Zoom call very effectively.
And so, Jeremy, was it a combination or a thought around doing both in person as well as virtual?
I don't know if the charge will change as the Capitol opens. You know, as many of these types of committees are meeting, some of them are meeting in person. Some committees like to meet in person. But I guess there's a huge advantage in the type of work that we're doing in this committee, so that we can provide access, especially if we're dealing with partners and community members that may not be able to leave work. This type of virtual format creates a lot of access that normally would not happen with in-person meetings at the Capitol.
Gotcha. Okay, because I know there was some discussion about possibly doing a meeting or two in person, but there was a consensus that we clearly definitely wanted to maintain the virtual presence regardless. And so we'll keep that in mind. Thank you, Jeremy.
Yeah.
David.
Got to unmute.
I'm muting myself. This may be an unpopular opinion to share, but one of the things that, and again, I apologize for being late. I was handling some patient care issues, but one of the things I've noticed over the years is there are many organizations out there that are not represented on the screen today, but do seek out funding from a variety of sources, both federal, state, private, et cetera, who get a lot of funding from those organizations, and they tend to not be evidence-based or not create evidence for the future. Do we have any jurisdiction and or influence into those organizations that have funding and what their futures will be like?
Thank you for reiterating that. We did speak to that earlier, and we certainly want to hear from those grassroots organizations or those non-traditional organizations that normally don't get a seat at the table or their voices heard and or incorporated into a plan such as the one that we're proposing. Thanks again for raising it.
Thank you very much.
Okay. All right. Going once, going twice, going 3 times. Okay, folks. Well, it looks like we got some good time to start with the rest of our day. I want to thank you again for joining on this particular call, our first call of the series. And I look forward to seeing all the information that comes in from each and every one of you, and look forward to our next meeting, especially hearing from individuals that would want to share and speak before this committee. And so thank you and have a wonderful day.